Welcome to our infant feeding and behavior prenatal class. My name is Berlin Carrizales. I'm a registered nurse with a certification in low-risk neonatal nursing and an international board-certified lactation consultant, registered lactation consultant. I am the director of Lactation Care Center, RGV, which is one of the 5 lactation support centers that the state of Texas Department of WIC has for the breastfeeding mothers in the state of Texas. I have no conflict of interest to declare, and I'd like to start the class by going over 2 statements that I really like. The first one is by Dr. Grantley Dick Reed, who is a British obstetrician. He says that the newborn has only 3 demands. They are warmth in the arms of its mother, food from her breast, and security in the knowledge of her presence. Breastfeeding satisfies all 3. The second one is an excerpt from a book published by La Leche League, Sweet Sleep, Nighttime and Naptime Strategies for the Breastfeeding Family. It says a mother and baby are 2 people but 1 person before the baby is born. And if they're breastfeeding, they continue to be an inseparable biological and social unit after the cord is cut. Your baby shares your immune system. Your milk production responds to his growth pattern and age. His heart rate, breathing, and temperature are steadied by direct contact with you. When he lies against you, feeling your warmth and heartbeat, he sleeps more calmly. So Texas has a wonderful support system for breastfeeding mothers. They have a website, www.breastmilkcounts.com. The state of Texas also has a breastfeeding hotline, which is answered by a lactation consultant 24 hours a day, 7 days a week, 365 days a year. Their number is 1-855-550-6667. And then, as I mentioned earlier, they have, at this point, 5 lactation support centers and hopefully more in the future to come. Lactation Care Center, RGV, is located in McAllen, Texas. We provide free support for breastfeeding mothers. The other lactation support centers are located in Austin, Dallas, Houston, and the latest being in San Antonio. We are grant funded, receiving grants from WIC and also some Title V grant funds. So our services are free for moms that even exceed the qualifications for WIC. We provide breastfeeding assistance. The most common reason we have mothers come to visit us in the clinic are for sore nipples, difficulty latching their baby. I guess the second closest would be for milk supply issues, typically a low milk supply. We prefer appointment basis because we ask you to bring your baby in hungry, and we can't have you sitting out in the lobby waiting with a crying baby for a long period of time. So we do prefer appointments, and we reserve the walk-ins for urgent issues, moms that have mastitis or severe engorgement, things like that. We monitor the baby's weight, we'll do a pre and post feeding weight. We'll check the baby's weight, allow the mother to breastfeed, and then we weigh the baby again to confirm the amount of milk that the baby transfers from mother's breast. And we have an instrument called the Chromatograph Plus, which will perform an analysis of the breast milk composition, and so we can tell you how many calories per ounce you have in your breast milk. We're open Monday through Friday. On Tuesdays and Thursdays, we do stay open a little bit later just for the working moms. We're closed on weekends and holidays. So the objectives of today's class is that upon completion, the learner will be more knowledgeable about the benefits of breastfeeding and the risk of formula feeding. We'll compare breast milk and formula, what to expect in the hospital, the golden hour, infant behavior, latch and positioning, making enough milk, the size of a baby's tummy. We'll talk about common struggles, building a support system, and then when to call for help. So these objectives derive from an article written by Katie DeMota et al. Back in 2012 in an article titled Maternal Request for In-Hospital Supplementations of Healthy Breastfed Infants Among Low-Income Women. And in this article, the lack of preparation for what the early postpartum period would entail, specifically in caring for their newborn, their need for rest, unrealistic expectations, the lack of preparation for the process of breastfeeding, and seeing formula as the solution to breastfeeding problems emerged from this article. And so they found in these focus groups that they didn't realize it was normal for their baby to eat every hour and a half or 2 hours in the first days. They didn't realize that their baby was going to cry so much. They didn't understand the size of the tummy. And so these are things that these mothers found to be a challenge. And so that's why we chose these objectives, so that we can enlighten you on some of these and hopefully decrease the risk of you struggling with your baby. So what and how a child is fed in the first 2 years of life is critical to their health, to their development, and to their survival. And this is derived from a booklet. It's really a good booklet that you can download the PDF and read in your favorite search engine. Look for UNICEF and then start typing from the first hour. So they say that children suffering from chronic malnutrition or stunting are not just shorter than they might have been if they had received appropriate nutrition, but their brains are also robbed of the ability to develop to their full potential. So this means that these children are going to fall behind in school. They're not going to learn as easily. And then as an adult, as they grow up, then they have a more difficult time finding a good paying job, and they can face lifelong barriers to participating fully in their society. So let's look at what the American Academy of Pediatrics has to say about breastfeeding. So they say that breastfeeding and human milk are the normative standards for infant feeding and nutrition. And given the documented short and long-term medical and neurodevelopmental advantages of breastfeeding, that infant nutrition should be considered a public health issue and not only a lifestyle choice. So many times people ask me, how long should I breastfeed? And so I like to refer to what I call the gurus. So we're looking at the World Health Organization, we look at UNICEF, the American Academy of Pediatrics, and the state of Texas. You could go on and on. You can look into what the Association for Nurses, Association for Nurse Midwives, the Association for Dietetics. But they all agree that for the first 6 months of your baby's life, the baby should receive exclusive breast milk. And then at 6 months of life, they all agree that you add complementary foods. And I'd like to point out the adjective stating complementary, meaning that it complements your breastfeeding. And so sometimes parents are told, okay, you were feeding your baby 8 times a day. All right, let's cut back to 4 or 5 times, nurse the baby 4 or 5 times, and give the baby 3 meals a day. But it doesn't say to substitute. It says it's complementary foods. And then you're encouraged to continue breastfeeding. So they differ a little bit, but the thing that they have in common is that nobody tells you when to stop. So World Health Organization says 2 years and more. UNICEF says 2 years and beyond. The American Academy of Pediatrics says a minimum of 1 year or while you're both mutually agreeable. And then the state of Texas says that 1 to 2 years and beyond is a physiologic norm and the optimal method of infant feeding. So we're going to change gears now and talk about the benefits of breastfeeding and the risk of formula feeding and comparing breast milk and formula. So breastfeeding has significant benefits for mother. Some of them are short-term, meaning immediate effects of protection against hemorrhaging after childbirth. But some of them are long-term, and for years down the road, she can benefit from a decreased risk of cardiovascular disease, high blood pressure and cholesterol, high cholesterol. Other benefits include decreasing her risk of diabetes type 2, decreasing her risk for cancer. So there are many health benefits that mothers obtain or they get when they breastfeed. And one that we always love is losing weight. So it does help you lose the weight that you gained during your pregnancy faster. You burn approximately 500 calories a day just by breastfeeding. It also decreases the risk of postpartum depression. The research shows that mothers who choose not to breastfeed or mothers who did not meet their goal had a higher risk of postpartum depression. It increases the child spacing due to amenorrhea, so meaning no period. So it's wonderful to go the 9 months without a period during your pregnancy, but if you breastfeed your baby frequently, you can go another year, year and a half, 2 years. Every woman is different. It also increases the bonding due to the oxytocin hormone. It's the love hormone. And so studies show that a mother is less likely to abuse her baby if she breastfeeds her baby. It increases our self-esteem. It's pretty empowering to know that we're growing this baby, but then to know that we're sustaining the baby, it is very empowering. I remember I never suffered from postpartum depression, but I do remember being able to cry at the drop of a hat. Somebody would tell me, your baby is so cute. And I would say, yes, my baby is so cute, isn't he? And so it is very empowering to know that you are the most important person in that baby's life. So it is quite beneficial to the baby, just as it is for mother. And there is nothing to compare to breast milk. Breast milk is live, has live immunity, and protects your baby, lines the baby's gut so that the baby has less issues with GI problems or with gastrointestinal problems. Decreases their risk of obesity because breast milk has leptin in it. Leptin is the hormone that makes you feel full. So leptin is naturally occurring in breast milk. And so breastfed babies learn at an early age to regulate their appetite. And research shows that even when breastfed babies are started on solid foods down the road, after they're 6 months and they're started on solid foods, that a breastfed baby continues to regulate their appetite quite nicely, versus babies who are formula fed tend to overeat and tend to be obese. Breastfeeding also decreases your baby's risk of developing both type 1 and type 2 diabetes and certain childhood cancers. And recently I read that any breastfeeding at all could decrease the risk of your baby dying of SIDS by 60%. So imagine if you exclusively breastfeed the baby in those first 6 months, how much more protection that would provide your baby. And an interesting thing is that if you're carrying a baby girl, if you breastfeed your baby girl, not only are you decreasing your risk of breast cancer, you're decreasing your baby's risk of developing breast cancer when she's an adult. It improves their intelligence, their vision, because of those long-chain fatty acids found in the breast milk help the brain to mature, and they help the retina mature so the baby has better vision and is more intelligent. And it improves their emotional well-being. I always say that there's a reason why God put our hearts close to our breast. Your baby feels your heartbeat every time they nurse. They feel you. They feel your warmth. They smell you. And that's comforting to the baby. And so breastfed babies are happier babies. I guess you could say it's one of my pet peeves to see babies who are left in a baby carrier, and they have a bottle propped in their mouth with blankets propped under it to hold it up, not even being held. Feeding is more than just nutrition. You're nurturing your baby, holding your baby close. Your baby feels your heartbeat, feels your warmth, smells you, and so that is reassuring, and so these babies are happier. It's beneficial for our environment. So the ecological footprint is going to be smaller if more people would breastfeed. So there's a less demand for diesel, less air pollution, less landfill, less transportation of the breast milk substitutes or the infant formula to the stores. Benefits for the nation. Melissa Bartik is a physician from Harvard who did 2 studies in 2010 and 2013, one on the mother and one on the baby, to see what she estimates that we could save. And she just looked if 90% of the mothers would comply with the minimal recommendation of the exclusive breastfeeding for 6 months. She didn't look to see if you breastfed your baby for 4 years or for 2 years or for 1 year. She looked at 6 months. And so she has estimated that we could save a combined total of $31.26 billion a year if we could comply with this, if we could increase our breastfeeding to 90% of the mothers in the United States. Just think of what we could do in 10 years to our national debt. This is from the Office of the Surgeon General. Back when Regina Benjamin was Surgeon General in 2011, she did a call to action to support breastfeeding. So this call to action was to the whole nation, including everybody, politicians, policymakers, the insurance payers, and even to the general public that we should be more supportive of breastfeeding. And so in this call to action, she has this table which shows the excess risk if a mother chooses not to breastfeed her baby. And so it's got some pretty interesting stats here. 100% likely your baby's going to have ear infections. 257% likely your baby is going to be hospitalized for lower respiratory tract disease in the first year of life. So this is some pretty interesting information here that she posted. Infant formulas are susceptible to manufacturing errors, to environmental and bacterial contamination. I remember sometime back, many years ago, that we had to remove formula from the shelves in the hospital because of a infestation of beetles in the factory where the formula was being made. And so we had to go through and look for the certain lot numbers and pull that milk off the shelf. But not only that, it's also susceptible to unsafe handling and misuse. And so here you can see a screenshot of the CDC's website. You can actually search for CDC and Chronobacter. Chronobacter is a bacteria commonly found in dry foods, and the infant powder formula is a dry food. And so this powdered formula could be contaminated. And so the recommendations is that, well, first of all, they recommend that you breastfeed your baby. And then they will tell you how to prepare formula. They tell you to start by washing your hands, washing the countertops, sterilizing the bottles, getting everything ready. And then you're supposed to boil the water. The water is supposed to be 158 degrees Fahrenheit when you mix the powdered formula. And so you mix it when it's hot and then cool it down and then feed it to the baby. And so oftentimes in the stores and the doctor's offices, you see them pull out their can of formula, and they have their bottle of water pre-measured, or they may use the water that they were drinking, and they pour 2 ounces in, and then they mix the scoop of formula, and they shake it, and they feed it to the baby. And so this is not the proper way of preparing formula. And so when it's medically indicated for formula supplementation, we want it to be done properly. So breastfeeding can save lives in emergency situations. And people don't think about this when they are considering which method to feed their baby. We live in a prime location where we could have a Category 5 hurricane. Thankfully, there's not been one here in many, many years. But just imagine that we were in a Category 5 hurricane. We run out of formula. Would we have a way to get to the store? Would the stores be open? Would we have a safe way to prepare it? And so breastfeeding can be breast milk can be the only safe food available for infants during those emergencies and can be life-saving. I have heard of in other cities where they were affected by hurricanes, how they were helping these newly delivered mothers that had been formula feeding previously, and they helped them to start latching their baby and start breastfeeding at that point. So here is a list of the ingredients that is found in breast milk. And so you can see that it has a lot of good ingredients. These are all human ingredients, so it's easy for the baby to digest. It's easy for the baby to absorb. And breast milk is live, as I mentioned before. It has live immunity. There's live cells. So if you were to look under a microscope at breast milk, you would see movement because the cells are live. So here are the ingredients of infant formula. And if you were to look at formula under a microscope, you would not see any movement because there is nothing live in formula. It has nutrients in it to help a baby grow, but it has nothing in it to protect the baby from getting sick like a mother's milk does. So we're going to change gears again and talk about what to expect in the hospital. So I would highly suggest that you do your research and see if there are any baby-friendly hospitals in your area. If you're attending this class from another part of the nation or another part of the state or across the world, look to see if there is a baby-friendly hospital in your area. The state of Texas has Texas 10-step hospitals, which have taken the 10 steps to successful breastfeeding, and they're working with the hospitals to get them on the pathway to become a baby-friendly hospital. So a baby-friendly hospital, the initiative was launched back in 1991 in an effort by UNICEF and the World Health Organization to ensure that all hospitals or birthing centers become centers of breastfeeding support. And so they've written these 10 steps of ways that hospitals can change their maternity care practices to be more supportive of breastfeeding mother. Let's talk about what to expect in the hospital. So prior to delivery, I would recommend taking a birthing class. It's wonderful that you're taking a breastfeeding class, but it's also important that you take a birthing class. And so typically in the hospital where you're planning to deliver, they oftentimes give free childbirth classes, and many times will give you a tour of the facility. And so I recommend that you take a tour so that you can ask lots of questions and see what their routine is. Do they separate the baby from the mother for several hours, or is the baby in constant contact with mother at all times? If you have an unexpected C-section, are they going to allow you to put your baby skin to skin? So after delivery, one should expect frequent feedings. So you should anticipate that your baby will want to nurse every hour and a half to 2 hours. That would be 12 to 16 times a day. Also expect frequent cries. This is the most common way your baby communicates with you. The first day, it's very common that the baby be very sleepy, and then the second day, the baby cries a lot. Also anticipate sheer exhaustion, especially when one chooses not to have medications to augment your labor or to speed up the process, and that is fine. But sometimes mothers labor for a long period of time before the baby is born, and so it can cause sheer exhaustion. So I would recommend taking naps, and also maybe consider even limiting visitors if it's impeding breastfeeding or rest. The golden hour, I love to refer to it as the sacred hour, because there's not a whole lot in life that is more sacred than the birth of your baby. So I like this saying that Dr. Raylene Phillips, a neonatologist from Loma Linda, California, has said. She says that in many hospital settings, this sacred event is routinely interrupted for details that can easily wait until their new baby has had time to adjust to life outside the womb in the loving arms of the mother, and after the baby and parents have had time to meet each other as a family. So I'm happy to say that across the nation, there are changes that are happening in the hospital settings where we are putting the baby skin to skin and allowing the baby to breastfeed before being interrupted for a weight or for a measurement. Here's a video by Dr. Niels Bergman. He's discussing the impact of skin to skin.
Myself, my particular interest is the first hour, the first 6 hours impacts how we're going to become socially and emotionally intelligent. This is the essence of my research. The babies that are put skin to skin are warmer, measurably by half a degree. They have a higher blood sugar. They have a better return. They are breathing better, but above all, they're awake. They're alive. That aliveness and awakeness has got an important dimension. They will open their eyes and connect with mother. The first thing would be that the baby's born and it must stay with mother. And it stays with mother on mother's skin. Mother's skin is different to the skin on the rest of her body, and it's designed to be the place where a baby's born. And when the baby's born, it comes here and it's warmer. It's 2 degrees warmer there. And the baby will get its warmth from there. All the mother has to do is to just hold her baby and love her baby. When baby is born, one of the things that we would want to say to moms and dads is that this baby knows mom. And mom's smell in the uterus, mom's taste in the amniotic fluid, the sound of mom tells me I'm safe. Now, when I'm born, If mom is there, then I know I'm still safe. When the baby's born, especially if it's premature, what we will do is to put the baby very tightly in skin-to-skin contact, so the baby's like in the uterus almost. That containment is deep pressure touch. Goes directly to the emotional processing unit of the brain and reassures the amygdala that you're safe. And it's very important to ensure that parents learn quickly they can do this containment touch. Extremely premature babies will be in a context where their technology requirements may make it too difficult to do the skin-to-skin. The baby may have extensive major surgery. The mother may have been herself so sick and so on. And yes, after weeks of being apart, you just start again. You just catch up. What you're then doing is optimizing the trajectory. We can recover some of these steps weeks and months, who knows, even maybe years later. The people who this baby should be exposed to are the ones who are going to be with this baby intimately, emotionally, closely for the next 2 to 3 years. I call part of the attachment environment, because now the baby learns that this is somebody that I must trust. The attachment environment can include grandmother or anybody who's going to be the committed, constant caregiver. A primary caregiver is the key thing for the baby's brain. It doesn't have to be mother. Mother might die. That happens in my country, unfortunately. And then another primary caregiver. The baby will not come to harm from change in primary caregiver. Can change primary caregiver once or twice even. But once you start passing the parcel and there's no primary caregiver, primary, 2 years, committed, babies start to decompensate. We need to be having a positive outlook with respect to the fact that babies who've had a very rocky start are not doomed in any way at all. We should be positive, but it can be hard work and it needs a lot of extra inputs. The earlier those inputs are provided, the better the long-term trajectory. And so we have occupational therapists, we have speech therapists. The earlier they can get in to work with supporting whatever deficits, whatever difficulties, whatever problems have been encountered, the better the long-term outcome is going to be.
So we see that it's very important for us to put our baby skin to skin once the baby is born. So the womb was the natural habitat for the unborn fetus. And once the baby is born, now mother's breasts take over the role of the womb. She provides shelter, she provides warmth and nutrition to the baby. So benefits of skin to skin for mom, it's going to increase the bonding. When you have your baby skin to skin, your baby touching you increases your oxytocin, which is the love hormone, which creates a bond between mother and baby. And so for this reason, all mothers should put their baby skin to skin, even mothers who do not have a plan to breastfeed. And so it promotes breastfeeding because the baby is pretty much sitting at the buffet, just has to help himself. It improves your parenting skills because you feel every move, and so you start to sense when your baby is barely starting to get hungry. So it does improve your parenting skills. Those little immature movements of the baby's hands, they're actually massaging you, and every time he touches you, you get a spike in your oxytocin, creating that intimate bond, but also it's responsible for the letdown, for the flow of the milk. You have an earlier expulsion of the placenta. I always like to tell a story about how when we first started doing skin to skin many years ago when I was working in the hospital setting, I remember one physician who would tell me after I put the baby skin to skin, "But Berlene, the placenta is not out yet." And I would think to myself, so what's she going to do? Is she going to throw her baby up in the air and say, "Woo"? No, she's holding on to her baby. She's loving her baby. She had her baby tightly in her arms. And so I would continue to do that. And one day, I took longer than usual because in those days, we would take the baby to the warmer and do the footprints, dry the baby, put the ID bands, weigh the baby, measure the baby before we'd finally take them over to the mother. Don't do that anymore. Now we'd go from the womb to the chest. So in those days, when we'd put them over there in the warmer, one day I took longer than usual, and that same physician who used to each time say, "Berlene, wait, the placenta's not out yet." Well, one day he told me, "Berlene, why are you taking so long? Where's the baby?" I find that when you put the baby skin to skin, the placenta comes out faster. So that doctor did a 180-degree turnaround. Also decreases bleeding, decreases your risk for postpartum depression, and it lowers your stress level. Benefits of skin to skin for the baby. So it stabilizes their heart rate, their breathing, their temperature, and their blood sugar level. We don't think of it being stressful to the baby being born, but it is quite stressful when we listen to the baby's heart rate. It's very accelerated. Baby's breathing fast. But when you put the baby skin to skin, it settles the baby down. The baby's heart rate comes to a normal rate, and their breathing also comes to a normal level. It helps them to transition to life outside of the womb much better. It decreases their pain perception. So those painful procedures that we have to do, like giving the baby the vitamin K shot, or giving the hepatitis vaccine if you consent to vaccines, or doing a glucometer to check the baby's blood sugar, those things are less painful if it's done while the baby is skin to skin or while the baby is nursing. It lowers their stress hormone, especially if you keep that baby skin to skin for at least an hour. Now, elevated cortisol levels is not good for anybody, right? And so by keeping that baby skin to skin, it lowers his cortisol level. It decreases the crying episodes and the duration of that crying episode. They cry less. They're happy with their mom. They have fewer infections because the baby is being colonized with your germs, so the baby builds his own biome, which is important to his gut health. And it decreases the birth weight loss. And the babies that did lose weight were able to recover their weight a lot faster if mom held the baby a lot skin to skin. I know we have spent an extensive amount of time talking about skin to skin and talking about the benefits of skin to skin, but I firmly believe that this is a key element into successful breastfeeding. And so I not only promote that you put your baby skin to skin within the first hour or two after delivery, but throughout the hospital stay, that you do frequent skin to skin, and also that upon arrival at home, that you continue to do skin to skin. So here we have another video with Dr. Niels Bergman talking about the social and emotional intelligence of infants.
The newborn child is a small human being with all its senses open, developed, and receptive. Babies are born sentient, aware, knowing, feeling, loving, expecting a relationship. Skin-to-skin contact is the particular piece that connects the mother's body to the baby's body, connects the mother's brain to the baby's brain. And now the mother's mind and the baby's mind start to develop social and emotional intelligence. But the body is the basis on which this builds. In this interaction, what then happens is that speech and language develop. Now my baby starts developing the ability to approach, emotionally to develop the capacity to love. The capacity to love is a reciprocal trust building between two people. And this trust, in fact, is required that I've got an inner security based on an outer relationship. The interesting thing about this skin-to-skin contact and what it does, it affects particular parts of the brain that have to do with your social and your emotional intelligence. You can get cognitive intelligence, IQ, without emotional and social intelligence. You can. Certainly you can. So I don't want to say that there's a straight line effect. So the important thing to distinguish is that what you're doing at this first hours of life is ensuring your emotional and social intelligence. To get a good schooling outcome, you now have the best launch pad for a trajectory. From this best launch pad, you now want to make sure that you play lots of peekaboo with your baby, that you read stories, that you carry, that you play with your baby. You are continuing the trajectory for good development. You haven't ensured it. And so it's not a straight line. It's not do this and that will happen. You've got to do all the pieces. And at each point, if you can make this trajectory the best one, then you will get that good outcome.
So now I'd like to talk about the hormone levels during pregnancy and lactation so that we have a better understanding of how our body works. So the purple line is a progesterone, which is the pregnancy hormone. And so towards the end of the pregnancy, the progesterone level increases. And the yellow line depicts delivery, the birth of your baby. During your pregnancy, when the progesterone is elevated or is high, it suppresses your prolactin, the hormone that makes milk, and your oxytocin, the hormone that's responsible for the flow or the letdown of milk. So at delivery, you have a surge in both your oxytocin and your prolactin. And at the delivery of the placenta, once the placenta is out of your body, that indicates to your body that you're no longer pregnant and it's time to start making milk. So that allows your prolactin level to stay elevated. The pink bars represent a breastfeeding. So we see that if a baby breastfeeds frequently, the prolactin level stays elevated, meaning that the mother will continue to make a lot of milk. And then we see where she skipped a feeding. Perhaps somebody volunteered to feed the baby the bottle during the night to let her rest. But what happens is the prolactin level starts to drop. And then she fed the baby, and then we see she missed 1, 2, looks like another 3 feedings. And so we see that her prolactin level continues to drop. So she's making less milk. At every feeding, she has a surge in her oxytocin. And that's responsible for not only the bonding, but also the letdown or the flow of the milk. The other hormone I want to point out is the estrogen level, which as long as mommy is breastfeeding frequently, that her estrogen level is low. And that is what's protective against breast cancers. And so we see in that spot where she starts to go a long time without breastfeeding, where she's skipping all those feedings. Now her estrogen level starts to rise. As the mother's breastfeeding less, then her estrogen level starts to rise again. Dr. Widstrom is a nurse midwife from Sweden who has discovered that all babies go through 9 instinctive stages during the skin-to-skin process. And I'm not going to go into this into detail, but I just like to point them out that you can read more about it online. so that you can recognize this whenever you have your baby skin to skin. And she says that all babies go through each of these stages before they finally nurse and fall asleep. So here we have another video by Dr. Niels Bergman, What We Can Learn from Horses, which discusses why a mother and baby should not be separated in the first hour.
Imprint training comes from French veterinary school. It's what is done to horses so that they can get used to humans. What they do to the horse foals is very, very similar to what we do to our babies. They will be sprayed with water in the first 10 minutes of life, and then rubbed with a plastic bag, and then rubbed with a towel, and all of that's done until the horse gets used to it and lies still. It takes about an hour. It's pretty much what we do to human babies. We take them away from mother, and we wash them, and we bath them, and we weigh them, and we use plastic gloves, we use a towel. It's very, very similar. But we spend 2 or 3 hours messing with the baby before we give it back to the mother. We haven't actually asked mothers or babies what they want. And indeed, what the research was showing was that those foals, their social and their emotional development 1 year later was much, much worse and impacted because of one single hour 1 year ago. When the baby is born and we separate it, it doesn't have any connection. It now becomes a being that's alone. We are nothing without our relationships. The Psalm 22 verse 9 says, I learned trust at my mother's breasts. Without trust, certainly I will survive, but now I'm number one and I don't need anybody else. I'm an island to myself. I'm no longer defined by my relationships, but you see, I've got to be that way because nobody looks after me when I cry. Nobody picks me up. Nobody comforts me. Hey, comfort myself. Look after myself. And yes, we change our personalities to become self-centered, self-focused, self-seeking, self. And, well, that might be a value for some people, but actually, it's not how our brains were intended to be. We were intended to be social beings. And so those foals, they are loners. They don't know how to be socially active. And if they do interact, it's with aggression. And so, yes, this kind of being alone will come with the tendency to be aggressive, to be fighting, more rapid to fight, more rapid to defend, or to retreat, to avoid. And so the social, emotional intelligence is lost.
So your significant other is encouraged to put the baby skin to skin also. I encourage this for when moms are exhausted or when mom needs to take a nap, or perhaps mom has been medicated or she had an allergic reaction to some medication and they gave her some Benadryl and that knocked her out. And so when moms are sedated, it is not safe for the baby to be skin to skin. And so this would be a great time for dads to get to know their baby and put their baby skin to skin. Daddies have oxytocin also, so it creates an intimacy between the father and the baby. And there's actually a research article that shows that parents that put their baby skin to skin, they had better parenting skills, there was more intimacy between the parent and the child, and they were more likely to follow up with their doctor's appointment at 1 year down the road. We're going to change gears here and talk about infant cues and behavior. So we're going to talk about hunger cues, crying, and the typical behavior in the first few days. So hunger cues, the early hunger cues, your baby is telling you, I'm hungry. So the baby will start stirring, they'll start opening their mouth, turning their head from side to side, seeking, rooting. This is a baby telling you, Mommy, I'm ready to eat. Mommy, I'm hungry. But if we don't feed the baby because the neighbor is there with us and we don't feel comfortable breastfeeding in front of the neighbor, then what's going to happen is your baby will start to bring her hands to the mouth, stretching and having increased agitated movement. And the baby is saying, Mommy, I'm really hungry. These are mid-hunger cues. And at this point, your baby would still latch on quite easily. But if that neighbor is still there and you don't feel comfortable breastfeeding in front of your neighbor, then what's going to happen? The baby will start with late hunger cues, where the baby is screaming bloody murder. The baby turns red. And at this point, your baby is telling you, calm me down first and then feed me. So we have to rock the baby, sway the baby, soothe the baby, let the baby suck on a clean finger and calm that baby down and then latch the baby on. I finally tell the babies in the clinic when they're crying like this, I tell them that everybody has to close their mouth when they eat. Even I, who I'm really good at eating, I have to close my mouth to eat. And so we have to calm the babies down, settle them down, rock them, let them suck on a clean finger to settle the baby down, and then we can latch the baby on. So normal infant behavior in the first couple of hours after birth. Typically babies are wide awake, they're very alert, and they love to stare at faces, they love to look at you and gaze in mommy's eyes. And they're very interested in breastfeeding. I always say this is the point when your baby falls in love with you and you fall in love with your baby. And so this is a wonderful time to breastfeed the baby. And in these first hours, your baby may nurse 2 or 3 or even 4 times. They'll nurse, take a little nap, and then decide they want some more. And that's why it's vital that mommy hold the baby those first 2 hours, that baby stay skin to skin with mom. If at all, if possible, if mommy is stable. Then like clockwork, after those 2 hours go by, typically babies shut down and go to sleep. Remember, it was very stressful for the baby to be born. And so this baby is going to shut down and go to sleep. And so during that first day of life, most babies are very, very sleepy. And so some tips to awaken the sleepy babies is practice safe skin to skin during mom's waking hours. Gently unwrap the baby, remove the baby's t-shirt. You can check the diaper, see if the baby's wet or dirty and change their diaper. That's pretty good at waking them up. Or you can have somebody, if they're visiting with you or if dad's there or grandma's around, they can rub the baby's feet or rub their back. And typically this is a good way to wake them up. If the baby is so sleepy and will not wake up, then we need to provide alternate feedings of express colostrum. So at the facility where you deliver, you can ask for help and they can teach you how to hand express. And you can hand express into a spoon or into a little medicine cup. And that can be fed to the baby on a little spoon or with a syringe can be given to the baby until the baby is awakened enough to want to nurse himself. And then on the second day of life, babies will cry and cry and cry and cry. They even have a name for it. It's called second night syndrome. And so the ways to cope with this crying is to reduce the number of visitors, not pass the baby from hand to hand, from person to person, turn down the lights or turn down the TV, feed this baby frequently, hand express, and anything else. Think of it as dessert. Feed it to the baby. Have your significant other or grandmother or somebody else that's with you, have them feed the baby the express colostrum with a spoon or with a syringe. And try to rest between feedings and hang tight. This too's going to pass. But I often say that it's like the terrible twos. It may start before they turn 2, that the baby is acting or misbehaving, and many times it lasts beyond the second year, right? And so I say sometimes it could happen before the baby reaches the second day, that the baby starts getting fussy, and it may last beyond the second day. It may be into the third day and maybe even part of the fourth day, but hang tight. if the baby frequently stimulates, it's going to stimulate your body to make more, and then your baby's going to be happy with the milk production that comes in. So does crying always mean that the baby's hungry? No, it does not. Babies cry when they need something to change. Babies cry when they have a need. And so just go through the list. We want to make sure, first of all, that the baby's needs are met, that the baby has been fed, the baby has a clean diaper, baby has been burped. But then you can also check to see, is the baby cold? Is the baby hot? Is it too much noise in the room? Is it too bright? Baby might just be uncomfortable, want to be left alone. If you've had a lot of visitors and everybody's been holding him, baby might want to be just left alone for a little bit. So now we're going to talk about latch and positioning. So we're now going to talk about latch and positioning. I always say that this is the foundation for successful breastfeeding. It's important that you have a good start. I like to give the analogy of building a house. If I decide that I have some really expensive furniture that I want to put in my house, but I don't have a large budget and I want to save money, so I pour a 2-inch foundation for my house so I can buy that expensive furniture, then I'm going to have some major problems. Those walls are going to be leaning, the ceilings are going to crack because the foundation was not good enough. It was not sturdy. It was not deep enough to support the weight of that house. And the same with breastfeeding. If we don't have a good start, if we don't have a deep latch, then we can end up with some problems. And oftentimes we see mothers with sore nipples because they were not latching their baby deep enough. I've even seen moms that ended up having a very low milk supply because the baby was just on the tip of the nipple, had a very shallow latch. And so we'll talk about how to achieve a deep latch. So our goal is to achieve a deep asymmetrical latch. So when you're going to breastfeed, you're going to have your baby turn towards you so the baby is facing you. The baby's nose will be at the nipple level. You can use your nipple to stroke the upper lip, and the baby will need to pick up his head in order to reach for the breast. And when your baby reaches, when he stretches his head up, this is going to open the airway, but it also is going to point your nipple to the roof of the mouth, and that is where your nipple should be pointing, towards the roof of the mouth. So many people think that it has to be bullseye, just in the dead center of the mouth, and that's what causes sore nipples. That's what causes nipples to bleed. When you do bullseye, then the nipple hits on the hard palate, and that's what causes your nipple to get sore. So when we position the baby in this manner, and the nipple is pointing to the roof of the mouth, then when it stretches the nipple out, and it typically stretches 2 to 3 times its normal length, then it will reach what we call the comfort zone, where the hard palate and the soft palate join. And that does not cause your nipple to get sore. It does not cause you to bleed. So we tickle the baby, stroke the baby's upper lip, or stroke up and down, and then you wait until the baby opens his mouth super wide like a yawn. And when the baby opens his mouth super wide like a yawn, and we like it to be like a 140-degree angle, we will quickly bring the baby in to the breast by pressing on his shoulders. And we got to do this quickly before the baby closes his mouth. So when you're bringing your baby into the breast, the chin should be the first thing that comes towards your breast. The chin of the baby comes in first, and then the baby will latch over onto the nipple and to the areola. So when the baby latches, you will see more areola over the baby's upper lip than you will below. Typically, the lower lip and the chin covers most, if not all, of the areola on the bottom side. And so this is why we call it an asymmetrical latch, because you see more areola on the top than you do on the bottom. Latching your baby on should not be painful. If it is painful, that's your body telling you that something is wrong. And so we would suggest that you insert a finger into the baby's mouth in between their gum to break the seal, detach the baby, and start again until it's comfortable. And once the baby comes off the breast, the nipple should be the same shape as before it went into the baby's mouth, except a little bit longer. So elongation is normal, but it shouldn't look squished. It shouldn't look like a lipstick tip. It should be nice and round, just like before it went into the baby's mouth. So here we see a deep asymmetrical latch, and I'm going to point out signs of a good latch. And so we see that she's got her baby's nose at the nipple level, and she's using her breast to stroke the baby with her nipple, and wait until the baby opens its mouth super wide, and then quickly bring the baby in by pushing them at their shoulders to bring the baby's body in closer to you, bring the chin in deep. And so here we see the signs of a good latch was at wide angle when the baby was coming to the breast. Once the baby is latched, we want to see flanged lips. The lips are curled outward. The upper lip does not flange quite as much as the lower lip, but it should be flanged. You should also see that the cheeks look puffy. They look full. And then the chin should be indenting the breast. If there's any space between the chin and the breast, your baby is not on deeply. So now we're going to watch a little 5-minute video. Your baby knows how to latch on. And so here it shows not only with animation, but also it shows with a real baby, the mother latching the baby.
Breastfeeding is instinctive for babies. This is not true for mothers who learn to breastfeed with practice and by watching others. Many mothers decide to try breastfeeding because they've learned about its importance to lifelong health and wellness. But to make breastfeeding work, it must be comfortable for you and your baby. Your comfort while you are breastfeeding depends primarily on where your nipple lands in your baby's mouth. And where your nipple lands depends primarily on how your baby takes the breast into his mouth. This is called latch-on. To understand how latch-on affects your comfort, let's look inside at the roof of a baby's mouth. Behind the baby's gums are ridges. Behind the ridges is the baby's hard palate. When your baby takes your breast into his mouth, if your nipple lands near the front of his mouth, your nipple will press against his hard palate. This is called a shallow latch, which can cause discomfort for you as he breastfeeds. If your baby breastfeeds with a shallow latch repeatedly, the friction and pressure may eventually cause you pain or even skin damage. Farther back in your baby's mouth, the palate changes from hard to soft. Some call the area near this soft palate the comfort zone. To get a better idea of where this is, use your own tongue to find your soft palate. When your baby takes your breast deeply into his mouth and latches on so that your nipple lands in the comfort zone, there is no undue friction or pressure as your baby breastfeeds. Latching on within the comfort zone is where breastfeeding is most comfortable for you and most effective for your baby. With most young babies, latch-on tends to go more smoothly if the mother starts by first triggering her baby's natural feeding instincts. Just like other mammals, humans are born knowing how to get to the mother's breast and feed. To trigger these inborn feeding instincts, start when your baby is calm, alert, and starting to feel hungry. Open your shirt and hold your baby skin to skin between your breasts. Relax and enjoy this feeling of closeness with your baby. When your baby feels the sensation and warmth of your skin against his, he will soon start to bob his head against your chest. Eventually, he will lunge down toward your breast. As your baby moves toward the breast, talk to him. Look into his eyes, stroke him gently, and encourage him. You can help your baby by simply moving his bottom toward your other breast while supporting his neck and hips. Remember, these are natural human instincts. Your baby knows what to do. When he reaches the breast, help align his body so that his nose is opposite your nipple and his head is free to tilt back. Hold your baby close, with his body pressed against yours and his chin lightly touching your breast. Wait for him to lunge for the breast with his mouth wide open. As he latches on, give him a gentle push from behind his shoulders. That last gentle push will help your nipple reach the comfort zone. When your baby has a good latch, you will feel a gentle tugging at the breast, but you should feel no discomfort. Remember, breastfeeding is supposed to be comfortable for you and for your baby. It should not be painful. If breastfeeding hurts, it's important to ask for help from a board-certified lactation consultant. The sooner you find help, the sooner you and your baby can start to relax and enjoy breastfeeding, which is how it was meant to be for both of you.
So now we're going to talk about positioning. We're going to go over different positions, and really anything that is comfortable for you and comfortable for the baby should be fine. There are some that I find to be a little easier, and the fact that mother is in control of the baby in the beginning. And so here we see a mother lying on her side, and this is great for those first hours after a C-section when mom might not feel like sitting straight up. Also, if a mother experiences a spinal headache and for her comfort needs to be left flat, she could breastfeed on her side. Also wonderful for nighttime feedings. All the recommendations that we gave earlier are still the same. We're going to have the baby facing mommy. We're going to have the baby's nose at the nipple level. Still the baby needs to come in chin first to the breast, have to have his mouth open super wide in order to achieve a good latch. This next hold is the football hold. And this is great for the second day after a C-section if mommy is feeling uncomfortable and doesn't want the pressure of the baby or the weight of the baby on her incision. She could hold the baby like a football. Also wonderful for babies who've been diagnosed to have reflux or if they have a cleft lip or palate, because the baby's head is up higher than her tummy, and so it is good for those conditions. So here she's holding the baby like a football under her arm. The head is supported by her hand. And again, when you're pushing the baby up, you're pushing the baby at the shoulders, not pushing the head in. That will close the airway. We want to push the baby at the shoulders. That will bring the body in closer to you, bringing the chin in first, and allows the baby to naturally tilt his head back to reach for the breast and open his airway and point your nipple to his palate. This position is called the laid back hold, or it's also called biological nurturing. Suzanne Coulson's a nurse midwife from England who's done a lot of research on this position. It's a natural position, a very relaxed pose. And this is a good one to try if you're having difficulty getting a deep latch. And Suzanne Coulson says that they're more likely to get a deeper latch because gravity, since the baby is prone, baby is face down on the mother, gravity brings the chin forward, and that helps the baby get a deeper latch. The cradle hold is what is the traditional hold, what most people see, or most people think that they have to breastfeed in this position. And I actually think that this position is better in older babies once they're really good at the breastfeeding and you've worked out all the kinks in the beginning. I don't like this hold in the beginning for new mothers because you're not in control. You can imagine your baby is some distance from the breast, and you would have to move either your elbow or your shoulder to get that baby in quickly and get the baby to close to the breast. And so you're not as in control in this hold. Now, doesn't mean that you can't breastfeed in this position. I like to encourage moms to wait a couple of weeks until the baby has better head control. Once they feel more confident in breastfeeding, if they want to breastfeed in this position, this is fine. Here we see mothers breastfeeding in the cross cradle hold. Now this is personally my favorite position for the early weeks in the beginning because mom is in control. When that baby opens his mouth widely, boom, you can bring that baby in quickly and bring that baby to the breast and latch the baby beautifully. In the cross cradle hold, it seems to be like a mix between the football and the cradle hold. And so you're just bringing the baby across you to the opposite breast instead of the football being on the same side, the same breast as the side your baby is on. Now we're bringing the baby over to the opposite breast. So the baby is lying across you. The baby is turned towards you, tummy to tummy, nipple to nose. You stroke, you stroke, you stroke. And when the baby opens his mouth super wide, you push the baby. See how they have their hands around the baby's neck, but it's at the shoulders. They push the baby in at the shoulders, and that will bring the baby's body closer to you, bring the baby's chin deeper into the breast, allows the baby to tilt his head back, to open his airway, and to point your nipple to the roof of the mouth. Here we see the koala hold, and this is pretty much where the baby is sitting, straddling your leg, sitting upright, and nursing. And this is great for babies with cleft lip or cleft palate, also babies who have been diagnosed to have reflux. So as I mentioned earlier, any position in which mom and baby are comfortable are fine. You may find that some in the beginning, in the early days of postpartum, that you find some are superior to others, easier to do than others. And as the baby grows, then you may choose to hold in a different way. And that is perfectly fine. We're going to change gears and talk about making more milk. Nope, let's do this again. Slide 56. So we're going to change gears and talk about making enough milk. So in order to make enough milk, it is important, it is vital that you breastfeed on demand. So every time your baby is hungry, breastfeed. When the baby is exhibiting those hunger cues, starting to suck on their fingers, starting to make those smacking sounds, rooting around for something to eat. And that could be every hour and a half in the first weeks. That is normal. So the frequent and effective removal of colostrum is going to make you make enough milk. So if your baby sleeps more than several hours, it's important that you hand express. And this milk can be given to the baby through an alternate method. So breastfeeding and hand expression in the first hour is vital to your milk production. It is extremely important. And Dr. Jane Morton, a pediatrician from Stanford University, has said that our hypothesis is that early, frequent, and effective removal of small aliquots of colostrum stimulates the breast, or programs it, if you will, to recruit the number of alveolar units, or the milk factory, needed for future production. So there was a research done by Leslie Parker in 2015 among some mothers of babies in the NICU, and they found that the mothers that hand expressed within the first hour of delivery, they produced 130% more milk at 6 weeks than the mother that did not start that early initiation of hand expression. So it's important that you breastfeed within the first hour of delivery. If for whatever reason you're separated from your baby, or if your baby is very sleepy, or your baby is not interested in nursing, then it's important that you hand express. You can ask your nurse to bring you either a plastic spoon or a medicine cup, and you can start hand expressing, and this can have a great impact on your milk production. So oftentimes I'm asked, when should I use my breast pump? When do I need to start pumping? So to be honest with you, in the first days, it is most effective to hand express. Of course, your baby is your best pump, but oftentimes mothers are interested in stimulating more to increase their milk supply, then the hand expressing would be more effective than using a breast pump. Colostrum is thicker than mature milk, and it's hard for the pump to get it out. So even if you feel breastfeeding is going okay, you can hand express after 4 or 5 feedings and allow your significant other feed that colostrum with a spoon or with a syringe or with a cup, even if you feel breastfeeding is going great. I always say that if we eat dessert after every meal, then we're going to gain weight, right? So there are 2 problems that babies so commonly have in the first week of life. 1, that they lose a lot of weight, and 2, that they get very jaundiced, that yellow tint of the skin. And by you giving the baby those desserts or those bonuses, that extra colostrum decreases both of those problems. But if you're separated from your baby, or if your baby is not latching on for hours and hours and hours and hours, and your baby's still not latching, then you may start pumping to start stimulation. Or if your baby is separated, sent to the NICU or sent to intensive care or under observation, then you should, within the first hour of delivery, start pumping. And recent research shows that it is most effective to start within the first hour and no longer recommended to wait till 6 hours as previously had been recommended. So they want you starting within the first hour, if mother is stable, to start pumping after delivery. So I would recommend that you hand express to collect that small volume that you're producing in a little medicine cup or a spoon first, and then put the pump on to further stimulate for 15 to 20 minutes using the correct flange size. We don't want to waste that small volume, precious colostrum that you're producing in those first hours. And so it's best to express it onto a spoon or to a medicine cup, and then you can put the pump on to express or to stimulate. Now later, when your milk volume increases, typically 3 to 5 days after you deliver, and in some moms that have certain medical conditions, it may be even 7 days after they deliver. At that point, you may start pumping after breastfeeding your baby to either increase your milk supply or to start storing milk for when you return to work. And at this point, we'll be pumping first and then hand expressing at the end to further finish emptying the breast. So I hope that's not confusing, but in the first days when it's such a small volume, we want to hand express first so that we can collect those precious drops of colostrum to feed to the baby. But once you get a bigger volume, then you'll do the pumping first, and then you can hand express at the end to further empty the breast. So according to that research article that I first mentioned in the beginning of our presentation today, when we talked about the objectives, one of the things that was concerning to mothers is that they didn't understand the size of the tummy. They thought that they had to produce lots and lots and lots of milk for their baby, and since they saw only drops coming out, they didn't feel that it was sufficient. So here we see that on the first day, the tummy is the size of a marble, has a capacity of about 5 to 7 milliliter, which is like 1 to 1.5 teaspoons. By day 3, it's the size of a ping pong ball and has the capacity of 22 to 27 milliliters, which is about an ounce, 3/4 to 1 ounce. And then by day 10, the size of a large egg and has a capacity of 2 to about 2 3/4 ounce. And so this is why we were made to make only drops in the beginning, because the baby's tummy is tiny and does not have the holding capacity for large volumes. So drops of colostrum is all that's needed at each feeding. And colostrum is actually higher in protein than mature milk. And so this is how babies are able to survive on such small amounts. And if your baby nurses frequently, your baby is imitating the nutrition that they received in utero. The baby was getting constant flow of nutrition, like a slow-flowing IV. So now that your baby is born, your baby eats a tiny amount, but a little bit later wants to nurse again, and a few minutes later wants to nurse again, an hour later wants to nurse again. And so those frequent meals stimulates the breast to make more milk. So I'm often asked by expectant mothers, how do I know my baby's getting enough? And this is a very important question. Oftentimes, I deal with mothers that have no clue. They have no idea if their baby is drinking milk or how to tell if their baby is getting enough. And so it's important to listen for swallows. And I have to admit that in the first days, it may be difficult to hear the swallows. A swallow sounds like the K sound. K, k. So I like to point out that you can also watch the sucking pattern, the rhythm of the sucking. When a baby goes to the breast, they suckle very fast. And that's the stimulation phase. That's to get the milk to start to flow, the colostrum to start to flow. And once a drop of colostrum goes into the baby's mouth, then the baby has to pause. And so you see the sucking pattern slow. So in the early days, you may see suck, 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 and swallow. Suck, 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 swallow. Suck, 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 swallow. So you may see 3 or 4 fast sucks and then a slow suck where the baby is swallowing. As time goes by, as the days go by and your volume of production increases, then you will see the baby swallowing more frequently until it gets to the point when you have a big production. Then your baby sucks, swallow, suck, swallow, suck, swallow, suck, swallow. But that may be several days before you see that happening. You also want to make sure that your baby seems satisfied immediately after eating, is relaxed, the facial features are relaxed, the little hand. When they're hungry, they make fists, they clench their fist. And when the baby is full, the baby relaxes and even their hand relaxes. So they're satisfied, at least for an hour or so. And then they're starving like you've never ever fed the baby. You want to make sure that your baby is peeing and pooping appropriately for their age. So I always recommend that you either download an app for your phone or you do it the old-fashioned way, pen and paper, where you write down how many times a day your baby is eating, how many pees, how many poops, and making sure that it's appropriate for their age. In the beginning, the early days, the baby does not pee and poop a whole lot, but as your volume increases, then the baby will pee and poop more frequently. And by the time you have a good milk volume, if your baby is transferring milk well, then your baby will be peeing at least 6 times a day and have at least 3 poo-poo diapers a day. And that will be so for the first couple of months of life. And then they slow down at that point. And you want to make sure your baby's gaining weight. So it's very common that babies lose up to about 10% birth weight in the first 5 days. Sometimes we see a little bit more, especially if it was a C-section. But the baby should be back up to their birth weight or more by 2 weeks of age, 10 days to 2 weeks. And then the baby should be gaining about an ounce a day for the first 3 months of life. And your baby is thriving and growing. So we look at the whole picture. We don't just focus on one thing, that my baby is eating every hour and a half. Because if your baby is peeing and pooping and gaining weight, that's just welcome to motherhood. That's normal. But if your baby is eating every hour, your baby hasn't pooped for 3 days, your baby is significantly below birth weight at 2 weeks of age, that baby is not eating and I'm concerned. So it is important in the first couple of weeks, just until you feel confident with breastfeeding, until you're convinced that your baby is eating well and is peeing and pooping up a storm and is gaining weight. I would suggest keeping track of feedings, keeping track of wet and dirty diapers so that you know that your baby is getting enough breast milk. So here I have a video of a baby in our clinic. This baby is already a couple of weeks old, so you can hear him swallow nicely. So once your production gets up to a good volume, then you're going to hear the baby swallow frequently. So many times you hear from your friends, from your relatives about issues that they've had with breastfeeding. And I'm going to be honest with you, many of those problems or many of these concerns are related directly to the maternity care practices. When babies are separated from their mother, when babies are not breastfed immediately upon showing signs of hunger because there's a lot of visitors in the room and we don't feel comfortable. Those are all things that can lead to challenges, that can lead to difficulty latching the baby, which can end up with causing sore nipples. And if your baby is not latching appropriately, or in some moms, even if they are breastfeeding fine, their body just makes a really good supply of milk and they may suffer engorgement. And so seeing a lactation consultant can help you with issues like this and give you more advice on how to manage them. A milk supply, again, if we're not latching the baby deep enough, it can cause your milk supply to decrease. Lack of sleep, so I really recommend that you take naps in the first few weeks, the first month or so. Both mom and dad need to take naps. It's impossible that you stay up all day and nurse and then wake up every hour and a half, 2 hours at night. And so chronic sleep deprivation can lead to illness because it suppresses your immune system. And it can also lead to depression. And so we want you to take care of yourself because your baby needs you. And then the lack of sleep can cause an increase in your anxiety. It can be a very anxious time in those first weeks after having a baby. We want everything to be perfect for a baby. And sometimes not understanding the baby's behavior or not understanding why the baby's crying or not understanding if the baby is getting enough milk can lead to even further anxiety. So it's important that you have connections, that you have friends, relatives to talk to, or you have a lactation consultant, or you find an outpatient lactation center where you can get help for issues like this. So breastfeeding can save time and allow more time for rest. I know it sounds impossible, but there's actually research behind this that shows that even though at first it requires a lot of effort, it takes a lot of mom's time, but by practicing, 10, 12, or even up to 16 times a day, the baby is going to get better and mommy is going to feel more confident. And so the research that I was mentioning shows that breastfeeding mothers, they end up getting more rest than mothers who formula feed their babies. And so many times formula-fed babies, they don't fall asleep right away because they have tummy aches. And so it may take time to get that baby comfortable to get them back to sleep. Whereas breastfed babies, they eat and they fall asleep very quickly. So let's talk about supplementation. So there are times when it is medically indicated to supplement. And so there are situations, there are health conditions that can cause a need for supplementation. If a mother has diabetes and even though she's breastfeeding very frequently and she's doing the best she can, her baby's blood sugars are still low, that would be a medical indication for supplementation. Or if the baby's jaundice level gets to an elevated or an unsafe level that baby needs supplementation. If a baby was born very tiny and typically under 2.5 kilos, if the baby was small, then the baby would need supplementation. So when we talk about supplementation, we don't necessarily, it's not always synonymous with formula. Our number one goal would be to get mom's breast milk. So maybe it's just the baby's having difficulty getting it out because the baby's very sleepy or the baby's very tiny, or for whatever reason the baby doesn't have the energy. Then we would have mom to express her breast milk and we would feed the colostrum to the baby. Our second option would be donor breast milk. Many hospitals purchase donor milk from the human milk banks for their population or for the babies in the NICU or the intensive care. So I think it would be worth the time to see if you could get donor milk to supplement your baby if your baby needs supplementation. That would require a medical consent, but it's well worth asking for. And then our third option would be formula, infant formula. And this is when the risk of not receiving sufficient nutrition would outweigh the risk associated with formula feeding. So if we have a baby whose blood sugar is very low and we cannot get any more drops out of mommy and there's no donor milk available, then in that situation, the risk of insufficient nutrition certainly outweigh the risk that's associated with the formula feeding. So we're going to change gears and talk about a support system at home and how significant others can help. I've actually been told over the years by mothers that they wanted to bottle feed. And their reason was because they wanted dad or they wanted a significant other to do half of the work. They wanted them to feed the baby half of the time at night too. So I often tell them there is so much that dad or the significant other can do. There are so many other ways other than feeding the baby that they can help. So first of all, it's great that you know the benefits of breastfeeding. So this would be a great class for the father or for the significant other to take so that they understand the importance of breastfeeding. But they can also take care of mom, making sure she's eating well. So oftentimes we neglect ourselves and we put our baby's needs first. So he can bring you a snack or bring you a glass of water when you're feeding your baby, or help. I like to give this job to dad, help limit the visitors. So if they're texting you, oh, we're all going, there's 50 of us going, the whole neighborhood's going, the whole clan's going over, maybe text them back and say, you know what, we haven't slept for the last 2 nights, or we've been in labor for this long and we haven't got any rest. Can we wait till next week? We'd love to have you come over to our house next week or whatever. Help out around the house. If you have other children, you can help take care of the other children, entertain them, help with the chores around the house, or hire somebody to help you in the first couple of weeks or that sort of thing. Reduce the stress for mommy and take care of the baby in other ways, doing skin to skin, bathing the baby, burping the baby, changing the baby's diaper, bringing the baby over to mom so that she can feed the baby, and then rocking the baby after so the baby goes to sleep, and then put the baby back in the crib. So there's lots of things that you can do to help mom, and always tell her she's doing a great job. So when to call for help. If you're having any difficulty or any pain while you're breastfeeding, if you are having difficulty waking your baby up to feed, or your baby doesn't want to wake up spontaneously for feeding, if your baby is not peeing and pooping appropriately, or having that black tarry poo-poo, what we call meconium, on day 4 or day 5, if your breasts don't feel warm to touch or don't feel full by your 5th day postpartum, then you need to call for help. Or if your baby is not gaining weight or thriving, call for help with a lactation consultant. Other recommendations that are supportive would be to sleep when the baby sleeps. So sleep deprivation can lead to illness and depression. And I still recommend limiting visitors in order to allow time to rest and focus on breastfeeding. I also recommend making a to-do list, and when your relatives and your closest friends come to visit, have it posted on your refrigerator door. And when they ask you, oh, what can we do to help? Don't just tell them, oh, no, we're fine. We're doing well. Let them know. There's a list on the door. You can take the dog for a walk, or you can put the clothes in the dryer, or you can wash the dishes. Also, contact your insurance provider about your breast pump prior to delivery. So some private insurances will send you your breast pump before you deliver. The Medicaid plans cover for a breast pump, but they want you to wait until you deliver before they will send it to you. Some insurances may require a doctor's order, others do not. So I do recommend that you call them prior to delivery and ask what's the protocol, what's the procedure that you have to do. Do you have to have a doctor's order or not? If so, get the fax number so that they can fax it to the company. You can also go online. There are many websites where you can go on, or you can put in your favorite search engine, how to get my breast pump for my insurance company, and all these DME companies from across, or durable medical equipment companies from across the nation will pop up, and you can put in your information for your insurance, and they will tell you, you get to choose from this one, or this one. And so then you can do your research and see which one is the better pump for you, or which one fits your needs. There are many good pumps out there, and so you can see which one best fits your needs so that you can get your pump, so that you can have it in case you need to start pumping early. Again, just to show you the support that the state of Texas has, the website, their toll-free number, and then here is our number for the Lactation Care Center if you are located in the Rio Grande Valley in South Texas. We would love to hear from you. You can go on Facebook and find us under Lactation Care Center RGV. Give us a like, or you can recommend us, or if you enjoyed the class, feel free to do a review. If you're in the area, if you in the surrounding area of McAllen, Texas, you're welcome to contact us if you're interested in taking this class in person. It is available. Give us a call for further information. Thank you for your time.